I'm going to tell you a little background. I got Lulu 2 years ago. So Portsmouth, I don't know if you're familiar with Gather. I met with Patty Gormley over there, and she introduced me to Lulu and the Hunger Monster and told me that all the kids in Portsmouth got this in the second trade. So I was like, well, all the kids in Concord are gonna get this. Great. So we met with the Concord School District. And they felt that it was a little young for second graders, they wanted it for third graders. They wanted it in the curriculum, they didn't want every child having a book, they wanted it in the classrooms, they wanted it in the libraries. So we did that, and we've got them in Bow, Hooksett, Allenstown, Loudon, Pembroke, Merrimack Valley, Tilton, so Lulu's getting around. Shay, who was in a meeting Googling Erik Talkin, he said he did speaking engagements. So thanks to New Hampshire Hunger Solutions, we were able to bring Erik here, and I'm happy to introduce you to Erik Talkin. He's the CEO and president of the Santa Barbara Food Bank.
Thank you so much, so glad to see everyone. Actually, I'm not president. I wanted to be president, but they wouldn't let me, so I'm the CEO. They have to keep me under control somehow. It's really great to see so many people here tonight who really care about kind of one of the most important issues of our time. So I'd love to share with you some of the work that we're doing and some of the echoes that I see in the work that you're doing here. So we're going to start off by reading Lulu to you. So it's your chance to go back to your child. So you can sit there, you've got a cookie. There's no warm milk, but there is some cold water. So it's an opportunity for you to hear what about 800 kids in this area will have heard by tomorrow. So there's been hundreds and hundreds of kids that I've got to see, read the book, talk about the issues that you're facing. So it's been really fascinating for me to see that. So it's a real kind of joy. So if somebody can, Rihanna, can you do the or John or it's working.
It's just complete.
Yeah. So you can, yes. All right, you all sitting comfortably? Remember the days where you could sit cross-legged? Those days are over, except for the yoga gurus, yeah. Okay, I'm going for a Buddha look myself. Okay, we can have the first page. With a grind and a clank. Whoops. Don't worry. With a grind and a clank, our old van slows to a stop. Mom can't start it. Monster waits from the roadside. Hi, Lulu. Long time no see. When we get a ride home, Monster buckles in next to me. So far, so terrifying. All Mom's money goes to fix the van. She needs it to drive to work. That means there's no money left for groceries. Mom says she doesn't think we can get help because she has a job. So we make do and make do. Ava runs up to me at school, her half of our twin necklaces dancing. She can't see Hunger Monster smirking, and I can't tell her. Monster made me promise never to say its name to anyone. Hunger Monster. Tell me one of your jokes, Ava says. But all I can think about is food, food, food. Why do the French eat snails, I ask? Because they don't like fast food. Ava laughs, and we join our friends to play tag before the bell. Soon I have to sit. My head is spinning, my stomach is noisy, Hunger Monster is growling. In math, Monster bounces on my table, so the numbers squiggle and jiggle. Mr. Abidi turns around. Lulu, please sit still. I want to tell him it's Hunger Monster's fault. Monster glares at me, so my mouth stays closed. During morning recess, Ava wants to play. My stomach is empty and achy, and I yell at her. She doesn't know why I'm being so grumpy. I go hide in the school garden. This year, Mr. Abidi is teaching us how to plant vegetables. Maybe there's something to eat in here. But the tomatoes are still green and hard. I kick at them. Temper, temper, Hunger Monster says. You know what you are? Hangry, hungry and angry. I invented that, Hunger Monster beams. The bell rings and I leave Monster gloating in the weeds. I always get free school lunch, so Monster will hide this afternoon, sulking in the hallways, waiting for another chance. Hunger Monster bugs me the most before lunch. In the morning, mornings like this one. I can't stop thinking about the cubbies out in the hallway, stuffed full of everyone's snacks. I raise my hand. Can I go to the restroom, please? In the hall, I reach for someone's lunchbox. Ants on a log, my favorite. I stare for a long time. Then I turn away. Hunger Monster won't make me a thief. Monster waddles off in a huff, and I make do. Next morning, Ava passes me a bag. I've got too much snack. Inside are grapes, yogurt, and cauliflower. I didn't want to take it. My face feels hot. I only take the bag because Ava is my friend. Monster shrinks that day, and the next when Veronica has too much fruit salad, and the next when Manuel wants help with a spare tamale. By Friday, Hunger Monster's no bigger than a toy. Everyone's whispering and laughing about you, it squeaks. After that, I don't take any more snacks, not even from Ava. A few days later, Mom gives me a bag for snack time. Surprise! There's a sun butter sandwich and string cheese. I peek inside her bag, plain crackers and packets of ketchup. It looks like I should spend the day with your mom, Monster says. No, I won't let you. I slip my string cheese into Mom's bag. That's cheating, Monster says. No matter, it'll be gone soon, and I'll be back. My shoulders slump. I can't keep standing up to this monster all by myself. At recess, I decide to talk to Mr. Abidi. Even though my stomach is full of snacks today, it still aches as I go to find him. I've never said Hunger Monster's name out loud. Even so, I have to do something for Mom and for me. Mr. Abidi is tying up the tomato plants and taking out the broken stakes, the ones I broke. As I unlatch the gate to the garden, Monster looms over me. You'll think your mom's a bad person. I almost walk away, but I can't let Hunger Monster trick me again. Ava comes up behind me and takes my hand. Lulu, today I have a joke for you. Why shouldn't you tell jokes to eggs? They might crack up. I want to smile, but I can't. I have to go talk to Mr. Abidi. Ava nods. Let me come with you. Together we pull weeds as I talk to Mr. Abidi about the car trouble, about how Mom's getting paid soon, but not soon enough. Mr. Abidi says he's glad I talked to him. I know about a place that can help. Now my tummy feels fine. Mom and I visit a food pantry. A truck from the food bank drops off healthy food. Everything's free and we pick what we need. Everyone helps each other, except Monster. All right, children, who can see Monster in the, let's go back to the last shot. There he is, sulking on the side. Mom and I head home in our van, leaving Hunger Monster far behind for today. Tonight, we're cooking a yummy meal together. I'm excited to help. And next week, I'm going to help with the food pantry because Hunger Monster is strong, but so are we. Story to kids and to see how kids have reacted, both kids who have read it before and kids who are hearing it for the first time today. And, in those huge classrooms, I know that, a huge percentage of people, kids in that class are food insecure at one time or another during the month or 1 month in the year, so it's like a live issue. So it's really a balancing act with those kids of deciding how do you, encourage people who are very afraid to say something to seek help and support? And also, how can you encourage those around them to help in a way that's empathetic rather than making the problem worse? Because this is one of those problems that you can make worse if you approach it in the wrong way. Okay, where's the clicker?
My hands go.
Darn, this is my clicker. That's weird. Why is it doing? You might be right. Okay, so as was mentioned, I'm CEO of the Food Bank of Santa Barbara County. So there's Food Bank in action. You've probably seen food banks, they're big, sort of huge Costco type places. We store food, we keep it safe, and then we distribute it out to a huge network of pantries and other agencies. So I've been involved in that for 16 years. For 7 years before that, I ran a kitchen and a homeless shelter. So I've been working in the food security sphere for over 20 years now. Still haven't solved the problem, but we are getting closer. So next slide. So I'm from Santa Barbara, so we need to deal with it right now, trying to get her. Straight away. You just had the rain as well, just to kind of make it worse, but so every time I have Santa Barbara on my badge, I go somewhere else in the country, they start laughing at me and say, there's no way there could be hungry people in Santa Barbara, right? And then I gently explain that there are 58 counties in California, and there are counties that have more food insecurity than Santa Barbara County. There's a lot of poverty around agricultural work in the north. There's a lot of poverty related to hospitality in the south of the county, very similar to, all across America, the way things kind of divide up. So it is a challenge. I visited Brazil, and there in Rio, the poorer people live in the favelas going up the hills outside Rio. Santa Barbara is just different. The rich people are in the hills up above, and the poorer people are down below. So otherwise, everything's exactly the same. So if I sent you a postcard from Santa Barbara, it might say this. Next slide here. Yeah, having a swell time, please send food stamps. Because that's the reality that a lot of people are facing. So, we talk about the cycle of hunger, this problem that starts off with children having, poor nutrition, that it really does affect not only their ability to concentrate, like Lulu couldn't concentrate in math class, not because she's a difficult person, but because she was hungry and angry. That poor nutrition can stunt growth. Chronic health problems can come when people are young. A lack of education as a result of some of those factors can limit their ability to work effectively. Poor health during pregnancy can start that cycle going. So that's what everyone is focused on, is trying to kind of smash those cycles that just keep going. The approach that we've taken is that, like, charity is not the way out of this, okay? Charity is this exchange, and it's kind of like a one-directional thing. I give you something, you're grateful for what I'm giving you, or you should be grateful, and then, that's it. I'm gonna kind of go away and do something more interesting. But we really kind of don't believe in that flow in the work that we do. We want to see a kind of a circle of energy starting. So we kind of switch from the idea of charity to community engagement, that we want to engage the whole community in changing things. So as I said, charity is really one direction, and often volunteers come in, do good, and then leave again, which is a bad feeling. So we like to think about a kind of a circle. How can we create a circle of mutual and equal benefit where the community is empowered to support themselves? So programs that we run, such as our Healthy School Pantry, really try and take that approach. So when I started the job, 16 years ago, I went to school pantry, and basically there's a bunch of bags of food in one room. Everyone knew that the poor kids went to that room. They came out with their bag. They really felt awful. Other, peers are looking at them, and it was just a really uncomfortable situation that was kind of disempowering. It's very easy to disempower with the things that we do. So something like the Healthy Community Pantry does something different. So imagine a circle we keep talking about. So what we try to do is create a new conversation, not a charity-based conversation, or not a conversation around lack, but a conversation around health. Okay, health is something that we all have knowledge about. We all have our opinions about what makes us healthy. So if we can make that conversation about health, it instantly becomes a more equitable conversation, rather than one around giving. So our distribution looks like this. People, if you look on the top right, people would come in, they would taste a recipe, they would get they would be taught how to make that recipe, they would get the ingredients they need for that recipe, as well as other food. And then they would have a whole range of other kind of health-related options or things that they could do. That might be other nonprofits who are tabling, doing screenings, sign-ups for SNAP, educational activities for kids. So these would be in the after-school space, after school is out or after the after-school programs are out. And it's just a way of really engaging people. And we've noticed a huge difference in the programs that we do as a result of that. That there's just as easy that disempowerment, and people really get excited and interested about how they can be more healthy. Next. So what we really try and focus on is the idea of food literacy. So you know that if you're illiterate or enumerate, you go through life with one hand tied behind your back. Food literacy or illiteracy is the exact same thing. If you don't have those basic skills of being able to kind of budget, prepare, shop sensibly, cook, and then store leftovers, then you're really at the mercy of fast food places, prepared food, processed food. But we find that, food, giving people food and then giving them these skills at the same time, really goes a long way to building food security during a month. Because, the month is the kind of unit of measure of food security. People are paying their bills, they paid all the money out for everything like rent. And the only thing that can change in that budget is food. So, the healthy food gets depressed totally. So money is spent on really poor quality food, which creates bad health, which means people can work less. And again, we get another one of those vicious cycles. So food literacy really helps kind of people empower them to take charge of their own health and to get them over those gaps in the month if they store food in a refrigerator or freezer. Next slide. So what did I do to kind of expand out on the idea? So I have a background as a writer and a filmmaker, so I want to kind of write about the experiences that we had and the things that we did in Santa Barbara. So I wrote a book called Hunger and Health. Jeff Bridges there did the introduction. So there you see two wonderful, healthy men in their prime. The only thing separating them is $100 million and an Oscar. But he's been a great supporter of the food bank, and we, really kind of value his presence. And I don't know if anyone saw that documentary, A Place at the Table, that he was involved in. That's a very powerful documentary as well. But it's too late talking to adults, right? It's too late. We need to go to kids and talk to them. So Lulu and the Hunger Monster was the first book that came. Luckily, it won a social justice literature award, and it's had a really kind of powerful effect. People have been really moved by the story and by the ability of that story not to kind of crush the feelings of somebody who is facing food insecurity, who is hearing that story. So it's been quite effective. And as with every happy birth, it's so much fun that other children follow behind. So there are two books in this series now. Jesting the Snack Food Genie looks at the issues of healthy food and how kids need to be able to balance out the snack foods that they're having with healthier foods that give them much more energy. And then Frankie versus the Food Phantom is really about the food system. If you play the next one, we have a little trailer that just shows about the three books and how they work together. I think, so we need the volume on this one. Yeah, must be on this.
Then introduce 7 to 10-year-olds to the world of food security, healthy eating, and the food system. In Lulu and the Hunger Monster, Lulu faces the challenge of hunger in the classroom. How can she get help with something she doesn't want to talk about? In Jessie and the Snack Food Genie, Jessie takes on the genie that wants him to live on snack foods. In Frankie versus the Food Phantom, Frankie faces up to a ghost who wants to try to stop her from understanding the food system and starting a community garden. How do we make sure that everyone in our school has enough healthy food and the skills to make use of it? Together, the Food Justice for Kids books can be powerful tools to foster discussion and understanding of food. 3 times a day, it's the most important thing in their world.
So that gives an idea of how those books work together. Yeah. So food insecurity, healthy eating, and understanding the food system. And then really the idea is that, you know, the first book gets kids to think about their immediate situation of their family and what's going on there. But, you know, we want to lift kids' views of what's happening. So, you know, immediate needs of food for Lulu, the family health and the family cooking together with Jesse. And then Frankie is churning that view out to the whole community so that we can take kids through that kind of progressive step. And the idea, you know about books being kind of windows and mirrors and sliding doors and ways that a child can interact to see a mirror to themselves, a sliding door through to a new life in some way or another life there, but also to understand how it's about their lives. So that's really the purpose of those books. So it's been really great just interacting with the kids and getting their ideas about how they can help about food security. And we had a lot of fun with this video where it features my daughter, Mia. She's 12 now, but she was 9 in this video. And it just shows about how her and her friends got involved in helping with food security. So it'd be kind of fun for you to see what the kids saw. Turn it up to you.
Hi, I'm Mia, and I like to take down the Hunger Monster. It's hard to help with a problem when you don't know what's going on, so you have to ask questions. Tough questions. Like, why do adults and the government allow there to be hungry kids in America? Even though there's plenty of food around. It's crazy. I had no idea until I asked that 1 kid in 7 is hungry in America. I also found out that food insecurity means when a family doesn't always have enough healthy food for the whole month. Empathy is not feeling sorry for someone, that's sympathy. I mean, I like sympathy, and he loves it. Empathy is trying to really understand how another person is feeling. You can listen, ask questions, and imagine what it would be like to be in their situation. I am 9 and I'm hungry all the time. So I could imagine what food insecurity could be like. But my refrigerator is full. What would I feel like if it was empty? Time to do something, people. When we don't need our masks anymore, the first thing you can do is share food with your classmates, especially when you see they don't have enough. Besides the people you know, you can help everyone in your town. You or your class can organize a food drive to collect healthy food to give to the local food bank. You can start a garden at home or at school to grow more healthy food for people. You can also volunteer to help at a pantry. That's a place that has extra food for people. There are lots of things that we can do to help. That's a fancy way of saying just stick with it. You can't just do one thing and hope the problem goes away. I started helping when I was a toddler. Though my dad didn't give me much of a choice at first. I love helping people get enough good food to eat. Kids can help kids take the lead and beat the hunger monster for good.
So that really got the kids inspired to be thinking about things they could do in their school. One of the schools had a garden and like people weren't doing much in it. And then they felt, oh, we should be doing more for this. And the school had not considered about donating extra food to local food pantries. So, you know, once kids get thinking about this, they get really excited and motivated. So the work that we're doing in Santa Barbara is about saying just giving out emergency food to people just changes nothing in their lives. So there has to be something else that comes with it. So the approach that we took is in terms of education and empowerment. But there's also other really key work, which is advocacy work. So we're kind of lucky in California in that a lot of kind of advocacy battles have been won already in terms of the state's perception of, what is appropriate to provide in terms of meals in schools and, other services. But, there's still a lot of work that, New Hampshire Hunger Solutions are doing here. And so, advocacy is really the kind of key. Do you want to do the next slide? I'm gonna get you all pumped up with some good quotes here. This idea of the Hunger Free New Hampshire Act is, such a kind of basic solution. We all saw during COVID, child poverty went down by 50% with just a few more government benefits, and it made such a huge difference. And, here we are back again after COVID, everything's creeping up again. So it's really, emergency food is not the solution. It is going at the state level and making sure that people have adequate benefits, that there are meals in schools for kids. It just makes so much sense. There is a quote about advocacy is the heartbeat of the community, and I've been really inspired to see in the last couple of days the work that New Hampshire Hunger Solutions has been doing in terms of going into schools, talking to kids, talking to parents. And that's really where things, where the groundswell begins. So that when all those people get together, then the politicians who, one of them, I sat down with a politician once who was blocking us building a warehouse. And she said, well, I'm complaint driven, that's how I approach life. I think folks should make a pretty big complaint about what's happening in terms of childhood. So really, you are the beating heart of advocacy in this room. Each one of you has incredible power and incredible voice. And I'm so impressed with the way that New Hampshire Hunger Solutions is inspiring everyone to work together to get these changes made, which frankly are, it's doable, right? We're not solving cancer. We're just trying to provide like basic food requirements in a state. So I'm really excited and inspired by the work that they're doing. So
I'm Laura Milliken. I'm the Executive Director of New Hampshire Hunger Solutions. And I'm Riona Core. I'm the Deputy Director of New Hampshire Hunger Solutions. And we're going to talk to you and give you a little bit of an overview of what we know about hunger in New Hampshire. And then we'll talk about solutions to food insecurity and hunger and what New Hampshire Hunger Solutions is doing to address it. And thanks for joining us. So without further ado, juggling things in my hand. So our system of food and nutrition supports is like a power grid, moving healthy food to individuals and families. In New Hampshire, the grid is well developed in some areas and patchy or non-existent in others. So where are the weak connections? Well, we would go a long way towards solving hunger in New Hampshire if everyone eligible for federal nutrition programs like SNAP, the Supplemental Nutrition Assistance Program, WIC, the Supplemental Nutritionist Program for Women, Infants, and Children, and school and summer meals participated. And you can see from the statistics that we're 39th in the nation in SNAP participation, 47th in the nation in school breakfast participation, 37th in summer meals, and WIC serves only 54% of those eligible. At the same time, recent economic trends, including the rising costs of goods, housing, childcare, are straining household budgets. Sorry, I'm having using a mic problem. I will try harder. For many, it's increasingly difficult to make ends meet. The most recent census household pulse survey, results of which are on the screen, showed that 54% of New Hampshire children and 41% of adults lived in households that reported having insufficient food. And in the same survey, nearly 1 in 3 older adults, or 31%, said that they didn't have sufficient food. So Eric talked about this a little bit, but while many people think only of food pantries when they think about how to solve hunger. The truth is that really the frontline defenses against hunger are the federal nutrition programs that are designed to improve food insecurity for all of us when we're in need. Like SNAP and WIC and school meals. And this is a slide from Feeding America, which is the nationwide network of food banks, food pantries, and local meal programs that shows that for every one meal a food bank can provide, SNAP can provide 9 meals. While food banks are critical to meet urgent food needs, they rely on charitable giving to operate. They're not designed to, nor can they solve hunger for the long term. And that's why New Hampshire Hunger Solutions is focused on increasing participation in the federal nutrition programs. There's evidence that they actually lift people out of poverty, and food insecurity and programs like SNAP can give people access to nutritionally and culturally appropriate foods for their family. I'm going to talk a little more about the challenges and opportunities and strengthening connections to food and nutrition supports, and we'll start with SNAP. So SNAP, some of you may know as food stamps, is the nation's first line of defense against hunger. Older adults on SNAP typically have improved food security, better nutrition, improved health, including lower healthcare costs, better medication adherence, reduced hospitalization, and nursing home admissions. Children receiving SNAP also have better health, are less likely to be obese, and their families are less likely to have to make trade-offs between paying for healthcare and paying for other basic needs like housing and heating and electricity. And as Erik aptly showed, they're less likely to have to face the hunger monster. However, we are close to the bottom of the nation in SNAP access for older adults. And this is a slide from our website. You can see by county in the far column, you can see the number of eligible people who are currently enrolled in SNAP, the percentage of eligible people. So only statewide, only 31% of eligible people are currently enrolled in SNAP. Okay. Before I fill in this slide, I'm wondering if anyone knows what the average SNAP benefit amount is per meal? Anybody have a guess? Nobody from my staff is answering that. So multiple choice, $2, $5, $10. Okay, I'll make it easy. $2.73 per meal. Does that match the average cost of a modestly priced meal in New Hampshire?
Probably not.
It does not. So this is the average cost of a modestly priced meal by county. And these data are actually a little bit old, so it may have gotten worse as food prices have continued to. So SNAP benefits don't cover the average cost of a meal in any county in New Hampshire. That said, SNAP is still the best program available for alleviating food insecurity for people with low incomes. We're advocating at the federal level to raise the benefit amounts for SNAP, but it still helps a lot. It's just that people run out of food in about the second or third week of the month. So in addition to making sure that people have enough food to eat, SNAP is actually good for New Hampshire's economy. SNAP benefits are entirely federally funded, and the cost to administer the program is split between the state and federal governments. SNAP is a very effective stimulus for economies. The U.S. Department of Agriculture estimates that for every dollar spent on SNAP benefits in times of economic downturn, $1.50 is generated in gross domestic product. And that's because people spend money on a SNAP EBT card. They can only use it on food, and they spend it in the local economy. It can't be used for anything but food. So there have recently been positive developments on the signing people up for SNAP front. In 2022, New Hampshire Hunger Solutions and our advocacy partners worked with bipartisan legislators to make sure that the state always has a SNAP outreach plan. They haven't had one for the last 5 years, which may be part of the reason that people aren't signed up for SNAP in the numbers that they should be. So in the summer of 2023, the New Hampshire Food Bank got the contract to administer the SNAP outreach program for the state. It's still really small. We're hoping to make it bigger, and the New Hampshire Hunger Solutions tries to amplify the food bank's efforts whenever it can. So now I'll hand it over to Brianna for schools.
Yeah, so I'm just gonna talk about our work in schools in New Hampshire and what we're doing. So school breakfast is one of our major things on our agenda right now. We must increase the school breakfast participation, just like Laura said, we are 39th of the nation in school breakfast participation. So we are 47th. 47th. Thank you. And we're at the bottom. Out of all the states in breakfast participation in New Hampshire. This is the participation in school breakfast by children by free and reduced compared to lunch. You can see that Beaver Meadow, so we just picked a school here in Concord since we're in Concord right now. Free and reduced breakfast participation and free and reduced lunch participation is about 39%. And like Laura said, there's a lot of people who are eligible for free and reduced lunch or for SNAP, which is directly certified to free and reduced lunch, that are not participating. So one of our things that we are doing here at New Hampshire Hunger Solutions is to increase that participation in free and reduced lunch within the schools at the child level by increasing the SNAP participation. This can also then increase percentages to other programs such as the community eligibility program to get everybody in the district or at the school free meals. So our plan is to then increase SNAP, increase free and reduced lunch, and then eventually get healthy free meals for all. One of our programs, if Karen is here she is. She is going into the schools and promoting breakfast after the bell. A lot of schools in New Hampshire do not have breakfast after the first bell rings. So breakfast is served before that first bell. And if we think of buses and bus schedules, a lot of buses are late. So those kids who are free and reduced lunch are coming to school late, missing that one meal that they're going to receive free a day or reduced a day, and then continuing on to the school day. So we're trying to offer this program that we vetted from FRAC to have breakfast be eaten after the bell, either by grab and go carts or by having the cafeteria open until 10:30 or so in some areas, or even having breakfast in the classroom. There are some schools that are allowing breakfast in the classroom for that administrator period, which is great. And I know there's a lot of barriers, but we'll go in and Karen will talk to administrators to see what barriers there are in the schools to have the breakfast eaten after the bell. These are the evidence-based data that we have. So if you eat breakfast at school, so this isn't talking about eating breakfast at home. This is school breakfast. School breakfast is USDA, there's nutrition guidelines, so it's very strict. So these kids are getting what they need for that full day. It increased school breakfast participation, wow. Participation. There's fewer occurrences in student hunger, so less hunger visits to the school nurses. A lot of nurses are buying food, snacks out of pocket. Hundreds of dollars. I was told today at one of the schools that Erik spoke in, $200 a month. Teachers are putting up for students hungry, and that is after the first bell rings before lunch. So those kids are not eating breakfast at school. Improved school environment, fewer tardy students, improved classroom environments. We talk about hangry in the book. That is something that we talk about within schools. Kids don't know what hangry is. I am hangry. I'm an adult. I get grumpy and then I have to think, oh, am I hungry? As an adult, I don't know how to really understand what hangry is. How does a child know that? So if you're having a fidgety child in the classroom, someone with impulsive outbursts, others, just poor behavior, we want to have that child eat something They might be hungry. They can't say, hey, teacher, I'm hungry. They just act out, right? So that's one of the things that we talk about with the students. Goes on with discipline, improved graduation rates, and improved math scores specifically. So we started the school breakfast challenge. Jessica's not here, she is zooming in from Georgia, but she did start the school breakfast challenge in New Hampshire. In 2023, Karen signed on about 8 to 9 schools to participate in the challenge. So we are challenging schools in partnership with UNH Cooperative Extension and New England Dairy Council to have breakfast nudges. So that is just nudging the parents about breakfast. Hey, breakfast is served. Maybe just adding it onto the school menu. And UNH Co-op put together a lot of things. Karen and the RCECs put up bulletin boards about breakfast in the schools. We also got one school
Regional community engagement coordinators.
Sorry. Okay, so also so bulletin boards, jokes in morning or afternoon announcements, just stating what is on the menu. We did presentations to wellness committees, talking to school boards, talking to, anyone about school breakfast to increase that participation. We had seen an increase of the participation over the school breakfast challenge. A couple schools, there's Somersworth School District was a really good participation in the breakfast challenge. They decided we helped them apply for a grant for smoothies. Every Wednesday they have smoothies made and they sell out. So the kids are coming in for breakfast for the smoothies. So we know that's happening. So we're increasing the breakfast participation with the challenge, and we're seeing that. And schools are already signing on right now. We're not even finished fully. We finished at the end of June. I think we're having a big celebration at around June 11th. And we see schools already signing on for next year, starting in 2024. So RCECs are regional community engagement coordinators, RCECs. They are our coalition leaders. So these are the coalitions across New Hampshire who are having the conversation about food access and using collaboration among stakeholders, just like CAFA. So CAFA created this opportunity for Erik Talkin to come in with Joanne and her group, which then just spread like wildfire over the state of New Hampshire to have Erik get pushed to 11 schools. So the RCECs are the ones who are doing the work. They're collecting the information. If there's barriers within the demographic that they can bring back to us for policy change, we will do that. We all know New Hampshire has very different demographics. We have the mountains, we have the cities, we have all different. It's a very unique state. And so there's culture within that we have to then try to bypass to see where the barriers are.
Have it on my, somehow can't learn that. Another piece of the work that New Hampshire Hunger Solutions does is focused on nutrition equity. We are working with healthcare organizations as well as community-based organizations to ensure that people are screened for food insecurity and referred to appropriate resources like federal nutrition programs, but also pantries to meet the immediate need. I know you can't read what's on the slide, but suffice it to say that we do trainings for community health workers, for community-based organizations about federal nutrition programs and how to help people apply. We work with healthcare organizations to implement screening as a part of their electronic health record system. And we're working with the Department of Health and Human Services to implement what's called a closed loop referral program. So basically people are referred to services and we know whether they got there. And we're working with community organizations to ensure that they know what they need to do and how to help people. So that's the health equity. Sorry, the slide got a little cut off, but this talks about our advocacy work. So New Hampshire Hunger Solutions advocates in the legislature at the federal level with with towns and you heard about with schools, to end hunger. This year, we worked with bipartisan legislators to, introduce a bill that we call the Hunger Free New Hampshire Act. It's SB 499. And it was more comprehensive. It in fact included some pieces that related to breakfast after the bell. The political realities of a non-budget year are such that. Pardon?
The petition.
Oh, we have a petition about 499.
Okay, great, yeah. But as amended by this and passed unanimously by the Senate, it still contains subsidizing children in the reduced price category to eat free meals at school, ensuring that children aren't hungry in the summer by participating in a new federal program called Summer EBT, which gives kids who are eligible for free and reduced meals in the summer, when they can't access those meals in school, their parents get additional dollars on an EBT card to pay for their meals in the summer. And the last piece is to ensure that older adults and people living with disabilities on fixed incomes can connect to SNAP. Now, last week in the House Finance Division 3, an amendment was proposed to gut the bill except for the Elderly Simplified Application Project. So we are asking people to reach out to members of the Finance Committee who will vote on it in the next 2 weeks. And to say, reject the new amendment, keep the bipartisan bill that was passed by the Senate. And this just shows the page on our website. You can see, we're asking you to go check the House Finance Committee to oppose the amendment. So go to NewHampshireHungerSolutions.org. That's our website. Go to Take Action and become an advocate, and you'll see the Feed New Hampshire Kids, Save the Hunger Free New Hampshire Act. Also on our website, you can sign up for our action alerts. So you find out when anything's happening in the legislature that we might need your help with. Pass it back to Brianna.
Yeah, so what do we need to do? We need to really link in that power grid of food access. Thank you. We need to make sure that more communities are plugged into the grid, more individuals in the communities are signed up for those federal nutrition programs that are available. Understanding and educating everyone in the community how to get free and reduced meals. If you sign up for SNAP, which we know there's a lot of eligible individuals, and if the household signs up for SNAP, they can get free and reduced meals. They can also get WIC if they have a pregnant, breastfeeding, or a child 0 to 5, if they have SNAP. So those foods, that's what we need to do. We need to plug everyone into this grid to increase the food access in New Hampshire. These are our focus areas. So this is the work that we do. We do a lot of work, a lot of spread out work, but it actually all combines and to end hunger for all in New Hampshire. So our focus area 1 is to close those gaps between the eligibles and those enrolled in federal nutrition programs. 2 is our child nutrition work within schools, support schools and communities to increase the participation in schools, school and summer meals. So we linked summer meals into this focus area to address hunger. We are working with schools for technical assistance for CEP, the community eligibility provision from USDA. We've talked to, I want to say, over 12 schools in the past 3 months about how they can increase their ISP, which is identified student percentage, to be eligible for healthy free meals for all, either by district level or by individual school level. Focus area 3 is to increase public and policy maker understanding of the solutions to end hunger. And 4, support and build food access coalitions to address hunger at state, regional, and local levels. And just like Laura said, please sign up look in your area on our website and sign up for the food access coalitions in your area if you have some passion for ending hunger in New Hampshire. These are our immediate strategies. We really want to get the word out about the federal nutrition programs. We know that emergency food system isn't going to solve hunger alone, so we need to plug people into these programs. let the schools know that Hunger Solutions is available. So the word is spreading. We just want, if you know someone in the school, please let them know about our work. We would love to help them. We work with them. We never go against, business administrators, food service workers, anyone that you can think of that would like to hear. We also put together a curriculum guide. It's up here, at our table, the child nutrition table. Come take a peek. How we can use Erik Talkin's 3 books as a curriculum base for 3rd and 4th graders. Schools are already interested, so if you want to make a donation for your area to buy those book curriculums for the schools, they don't have the funds. A lot of schools' budgets did not get the funding that they need. So you can be that donor to purchase that curriculum for your schools. Advocate for policies and reduce hunger. Sign up for the action alerts. Advocacy never ends. If it goes to the Senate, we still need more advocacy for the House. So please continue to take action. Join the statewide Food Access Coalition. Tiffany, wherever she is, she runs that with Brody, and you can sign up, and that kind of goes over everything we do across the state. Take the pledge to end hunger, follow and share our social media. You can sign up for Facebook, Instagram. I don't think we're on Twitter, are we? We are, right, follow Brody on Twitter. Support by donating. We cannot do this work without you. We can't, so please send it to anyone who you feel like would be a good donor. We work with organizations, banks, anyone who has grants open. We would love to work with you. And support the work of the New Hampshire Food Bank. So if people don't understand SNAP specifically, they can then ask the food bank to sign up individuals for SNAP. They hold that outreach grant. If you would like SNAP to be spread at some sort of community engagement work, ask the food bank to come, because they can be the ones to sign individuals up for SNAP right there at their table. And support local food pantries. And this is our QR code. I'm not sure if that'll work, but you'll see our QR code everywhere. Click the QR code, share it to a friend, share it to a colleague. So these are all of our handles for our social media, and that's it.
Great, thank you. And so there's really nothing that New Hampshire Hunger Solutions does without partners. We partner with the New Hampshire Food Bank, we partner with healthcare organizations, we partner with many others. And if you're not already partnered with us, please reach out. We would love to work with you. Please follow us, and we look forward to working together to end hunger. That's the only way we can do it. Thanks. So we're just gonna, we have a panel of speakers so that people can ask questions. We're just gonna take a second to arrange chairs, and
And we'll have our panel members come. And please come look at the table, look at the child nutrition work. There's flyers, brochures, pins, pencil. Concord School District is here.
So they're not. Hey everyone, my name is Dr. Bell, and I'm the AMD Community Engagement Coordinator for the Coast and Dairy.
Good evening, everyone. My name is Chelsea Laguerre. I am the Regional Community Engagement Coordinator as well, but I facilitate the areas of Manchester and Greater Nashua.
Hi, I'm Jen Albertizer. I'm a board member for New Hampshire Hunger Solutions. I'm the program manager for community health at New London Hospital, and I have lived experience with food insecurity here in New Hampshire.
And we know Laura and Erik, and we are taking questions. So I will be Vanna, and I will be running around the room. So who has questions for our panel?
We've talked about a lot of people that you are partnering with. I just wondered, coming from the medical community, I wonder how we're doing, because I can see the books going into pediatricians' offices, or, you know, even your bulletin boards in the office so that parents see it. So that I just wonder, you know, years ago, the docs would say, oh, don't worry about hitting little John, and we'll take care of you. And then all of a sudden, you know, the whole issue about violence came up, and now everybody's, you know, able to report. I just wondered about food. That seems to be as important to me, and having worked in the school system, I know how many kids would come into me to ask for food. So I just wondered where the medical community comes in.
I feel like that was a planted question. In my role, I have a new role at New London Hospital as the program manager for community health. Previously, I'd worked at Dartmouth College studying geographic access to healthcare services with particular focus on rural cancer care. One of the things I have realized as I've come into the hospital system, sort of meeting the needs around social determinants of health, food insecurity, leading the community health needs assessment, some of this is just evolving. You know, we have community health workers who are paired through the primary care providers' offices, now being reimbursed for their efforts to be able to pair people who are screening positive. I think Laura had a slide about the screeners at the hospitals where people are being asked questions about their social determinants of health. So I think, you know, when I think of the clinical environment and then also public health, those two things are now working in more alignment when it comes to social determinants of health, recognizing that 80% of health outcomes are tied to those social determinants of health. Only 20% of them are tied to any kind of clinical intervention. So, you know, food insecurity, I've been doing the community health needs assessment for New London Hospital. It's an affiliate of Dartmouth Health. It's coming up in every demographic, food insecurity, children, you know, families, seniors, particularly homebound seniors. So I think there is a directed attention, at least in the Dartmouth Health system, and that's the system I work in, to you know, take that seriously and recognizing the way it affects clinical outcomes for patients and their health and well-being.
And I just add, I mean, Dartmouth is one of the leaders in ensuring that that all of their patients are screened for food insecurity, and many of the other health systems in the state are joining in. And we're, at the policy level, we're trying to ensure that there are reimbursement mechanisms available so that those services can be paid for, which of course is an incentive to do the screening. So that's where.
Hi, my name's Lonnie. I've been recently working with St. Vincent de Paul, and I've been working down in Florida on 192 in Orlando. And coming across some of these problems, one of the things, I just recently had a mother that I talked to about having breakfasts within the school, and she didn't want to have anything to do with it. She was afraid of losing her child. If anybody knew that I couldn't feed my child, they'll take her away from me. So that was one question. How do you get over that? How do you get past that? The other thing is, and even though I reassured her, she's still, you know, like, I don't want to tell anybody. The other question is, you know, we're asking to have people sign up for SNAP. But I'm working with a population that is homeless, and they don't have, every time I've met with some of these individuals, you know, they talked about like they can't sign up for SNAP because they don't have an address. How do I get an address for somebody, you know, so that they can get food stamps? That's a huge hurdle that I'm finding.
The coalition and homelessness. So they can have.
What's this?
Well, the coalition to end homelessness in Concord, it's down the street here, and they allow people to have mail there, and they can use that address.
So is that nation, or is that just here in?
So you can sign up for SNAP if you are unhoused. You can list an alternative address. You can no one at the SNAP office should be saying that you can't sign up for SNAP because you don't have an address. And if they are doing that, I really urge you to contact New Hampshire Legal Assistance and let them know. Ask the person if they'd be willing to talk to New Hampshire Legal Assistance. But also, you know, send me an email and we can see what we can do, because it's really that's unacceptable.
So that was not here, that I just barely back in Florida this week, and I've been working down there, and I must have had 5 clients that I've talked about.
So that is nationwide. People need to be able to sign up for SNAP whether or not they have addresses.
Thank you.
With the morning food program at the schools, does everybody get it at no cost? Okay, so there's no discrimination between income levels. And the other item is, you know, do we have documented test scores if you want, I'm just gonna feel that you'll end up with better education, again, that's better comprehension from the kids because they, the meeting.
I guess I'll answer that. So yes, we do have data. We collect the data for improving test scores for those kids. No, it's not free for everyone right now in New Hampshire, although you may know that all of our neighboring states, it is free for all. Within the schools, we are encouraging, so during COVID, it was free. Right? And remember during COVID, there was a waiver, it was all free. Test scores did get better. Kids' behavior a lot better. Right now, it's not, so it's 135% free reduced.
130% for free, 100, up to 185 for reduced.
A federal
poverty though, yes.
Yes, SNAP is 200%, and you can be directly certified. So anyone in the household receiving SNAP, the child can get free and reduced, breakfast and lunch at the school. It's a direct certification. It's downloaded every day from the school. So if you're having kids in the school system who are, the families are making too much money for free and reduced, the next one is we're encouraging the SNAP applications to happen. And you may see around Manchester, Nashua, Concord will be getting some signs. Across the state, we're doing some signage for QR codes for signing up for SNAP. That's why we want SNAP. That's why we're pushing SNAP for kids.
It's worth saying though, that there are people above those levels who are still having a hard time making ends meet. And that's why we're trying to raise the eligibility for free meals and ultimately get to free meals for all. We're okay with, we don't ask kids about their income to get on a bus. We don't ask kids about their income to get books at school, but the most fundamental thing, which would be enough fuel to make it through the day, is we create this multi-tiered system, so.
Seventh in the nation for staff, or no, first,
Meal 39%.
39%, okay. What are the barriers that stop people? I had helped a family member apply for the different services because it's disabled. And it was not easy. Now it might be much easier now, but what are the barriers that stop people? And hearing a mom say she's afraid she might lose her children. What stops people from applying if it's federal money and it's there? That's fine.
I mean, I think I can speak for personal experience, that like the stigma, being a parent and having to go through the process, and it is a process, just coming up with the paperwork, making appointments and, having to talk to your employer, get the time off or, fill out paperwork, that's a huge barrier. Also, another thing could be like language, not all people have the same understanding of knowing how to follow through within the process or so making sure that there's people there that can help them walk them through the process, so that's also another big reason. Another reason could be just the gap, the difference that, the mindset of like, people thinking that, okay, well, hunger doesn't exist in this area, but helping people understand like hunger looks different to all people, so it's not just what we have a perspective in, but helping people understand that hunger looks different to all people, so even that, so.
Sure, that was a very moving story, and this is certainly an important issue. I'm wondering, what gave you the inspiration to present this issue as a children's book so that children understand it better?
Well, I mean, in my experience of working at the food bank, we have worked with a lot of families. So you kind of see the same thing over and over. And, we understand about the stigma that the parents feel, but, I really became aware of the stigma that the children feel and how they kind of internalize that. And I mean, you can only imagine how difficult it can get at certain grades if People are looking at what clothes people are wearing, and there's all this obsession with this and that. That, you know, food security is something that just, you know, it's not gonna be a good look for people. So I just was wanting to, as I said earlier, just have a book that would work for people who, kids who were food insecure, but then also other people as well, to figure out how they could, as a class, build solutions together. So that's, yeah, that's the reason why.
We have time for one more question.
Hi, Joanne Burke. I'm also on the board and nutrition professional. So Eric, my question is for the next book. What about one that's middle to high school that takes on the whole political policy side? Like, we have hunger because we have made a political decision not to really address poverty. So having read Matthew Desmond's Poverty by America and looking at the system, now and I agree that we need the emergency food provider network. We can't let people go hungry while we're waiting. I am so lucky to be serving on the board of Hunger Solutions because we are building out this network. But it is also so much of the understanding is in this arena of the SNAP recipient, and we have all these people that make more than 30,000 for the year who can't be eligible for a family of 4, 30,000 about. And the poverty rates are abysmal for a developed country. So my question is, can you write a book that tells us?
Feeling the pressure. I mean, I'm not sure I'm mature enough to write for older or something like that. My worldview is not that, but yeah, I think that's a great idea. And, you know, obviously, hunger is, you know, kind of a gateway discussion, right? Because hunger is just a symptom. It's not the problem. Poverty is the problem. And yeah, that's a big focus area of mine. So that's certainly something we'll discuss. It's not the next book though, which is another one in this series that looks at messaging that children get around their body image, because that is a huge, huge problem. But I think it's a great idea. You know, poverty is something that has to be tackled. Jeff Bridges, unfortunately, had his quote saying, you know, we can't solve poverty, it's too complex, but we can feed a hungry kid. But yes, we can solve poverty because that is the #1 issue. And I was at a conference last week and this lady stood up, who was a food bank CEO, and she said, you know, I remember back in the 60s, you know, we had the war on poverty. It was amazing. And now it seems like we have the war on people in poverty. And that's not so amazing.
Thank you so much. I just want to, for those of you who had questions you didn't get to ask, please feel free to reach out to us. Business cards for Riona and me and Tricia are all on the table over there. And please contact us and get involved.